And we're back on Second Street talking about detecting and fighting breast cancer. Leah, before the break, we were talking about sort of the problems in the system and the fact that some of these federal guidelines are just not recommending that women get these ultrasounds, which obviously helps save your life. What's your message to Ottawa when it comes to the status quo and what you think needs to change?
Well, I think it's actually criminal to sort of so actively and deliberately prevent women from getting proper health care. Like it's actually killing people. It's actually murder, and it's actually like deliberate. They have a choice to do it differently. I just wanted to say, like, for the people listening out there, until I actually got breast cancer myself, I didn't really fully get what the difference is between getting it caught early versus caught late at stage 3, like I was, or God forbid, stage 4. At least mine, I have a chance that it's been cured. At stage 4, you don't. So the difference is that for someone where it's caught early, you might end up with a lumpectomy, which is a smaller surgery. You might end up with some radiation. Because mine was caught late, I did 4 months of chemotherapy. I had to have a double mastectomy. I had to have 4 weeks of radiation and then reconstructive surgery. And I'm on drugs for the next 10 years of my life as an insurance policy to see if to try and make sure it doesn't come back. And the drugs are not easy. These are intense drugs that that take down my immune system. I have to have blood work done once a month to make sure I'm still alive enough to continue the drug regimen, to make
Mhm.
sure my liver and my kidneys and my heart are still functioning enough to actually withstand the treatment. So it is a big deal from a quality of life perspective. And I'm the lucky one where it wasn't a stage 4 when it was essentially caught. And on that note, another challenge that we have with the waiting lists is that, you know, the waiting lists in Canada say, well, here's when you were diagnosed versus when you got treatment. And yeah, we're slower than a lot of countries, but it's still not bad. But we don't even track the data from when did you try to start getting a diagnostic to getting the
Mhm.
diagnosis. So that's the difference between stage 1, stage 2, stage 2, stage 3, stage 1, stage 4. I happened to get an MRI out of the States. Like the lump that Paula found was about an inch. The MRI that I got privately within a week after she told me that I had cancer showed that it was nearly 9 centimeters because the level of detail in that MRI was extraordinary. I came back to Canada with that. The surgeon looked at it and said, we've got to triage you and get you into chemo right away. And so, because of the MRI that I got outside the Canadian system that showed how serious my situation was, if I survive this, it is
Mhm.
because I got the extra diagnosis eventually that I
Mhm.
needed in order to get on chemo right away. Instead of, if I didn't have that MRI, I would have been starting chemo when I actually finished it, if that makes sense, about 4 months early. So it's a big deal.
It, it's appalling what you're going through, what you've had to go through, Leah, what you're continuing to go through, and how, as Dr. Gordon mentioned, people have been talking about the need to change the system for years now. Dr. Gordon, final thought to you. We've got about 30 seconds left. Um, what's your message to women about this issue who are hearing this and are quite concerned? What do they need to do?
It's really tough because there's not that much people can do. Now, there are some efforts people can make to reduce the risk of getting breast cancer in the first place. I
Mhm.
would direct you to some websites instead of me talking about it a lot. Women should do breast self-examination. They should get to know what their normal breast tissue feels like. So if they do develop a lump, they'll detect it as small as possible. And then women have to learn to advocate for themselves because the system is too quick to push them away.
Mhm.
Okay, listen, thank you both for taking a few minutes to chat. Leah, thank you for being willing to share
Thank
your story,
you.
and Dr. Gordon taking your time to talk to us about this important issue.